common question we get in the office is about headaches, neck pain, and concussion after whiplash. These things are super common when you're in a car accident or even just a slip and fall, kind of sports injury thing. You tripped over your dog, that kind of thing. But effectively what happens in whiplash injuries is your head's going to move one direction quickly and then back the other direction quickly. When that happens, it moves like a whip, hence the name whiplash. But when that happens, all these little muscles of our neck that are really designed only for small movements, they're really designed for just helping you rotate or laterally bending or looking up, that kind of thing, they get asked to stabilize against this huge force from a 3,000-pound car hitting you from behind, or fall off of your snowboard or that kind of thing. In doing that, those muscles contract, so they try and shorten to keep your head stable. But when you have that second part where you whip forward again, all of a sudden they get pulled apart. When those muscles get pulled apart, you get what's called a strain to those muscles. And so reflexively, those muscles, they get torn, they get damage, inflammation, that kind of stuff. But reflexively, they're going to tighten up. Basically, you pull those ends apart. They want to pull together to kind of mend and fix those tears. What that feels like for you is a ton of spasm and muscle tightness and things like that. So that spasm and muscle tightness can lead to headaches. The other thing with concussion, effectively, when a concussion happens, your brain sits inside your skull, and during that whip-like motion, your brain slides back, hits the back side of your skull, and then when you go forward, it can slide forward and hit the front side of your skull. When that happens, you get damage to the control center, to the brain. We call that a concussion. That leads to all kinds of symptoms, but most common is feeling like you're in a mental fog, headache, loss of consciousness, irritability, sleeping more, sleeping less, forgetfulness, all those kind of typical concussion symptoms. Again, super common in whiplash accidents because, again, if you're at a stop and somebody hits you going 60 miles an hour, and their car weighs 3,000 pounds, just the physics of that, relying on these little muscles, it's not going to end well, which is why those muscles get damaged, why you end up with neck pain, why you end up with headaches, and often concussion. So if you're experiencing headache, neck pain, concussion, any of that stuff after a car accident, after slip and fall, it's something we can help with. It's something we help with a lot. We treat a lot of people in the office with those symptoms. We have a number of ways to fix that, but typically we want to start by just helping those muscles, helping to decrease inflammation, helping to sort of get you back into a better spot. We'll use laser therapy, we'll use massage therapy, we'll use dry needling or acupuncture, that kind of stuff. We'll do some focused stretching, some easy mobilization, that kind of stuff. And then once you're kind of out of that acute phase, we have physical therapy here to help you strengthen those muscles that were damaged to really, fully fix the problem. So we've got all the tools we need in-house for you to fix that problem. The other good thing is that if it was due to a car accident, then 99% of the time we can get all of your bills covered by the auto insurance, whether that's your insurance or the other person's insurance. Kind of depending on the situation, we can help you decide how all that should work and the best way to do it. But those situations are great because all you have to do is worry about coming in and getting treated. We can use any modality, any technique that's needed for your situation and get you better, and they pay the bills. You don't have to pay anything. So if you've been in a car accident, if you've been in a slip and fall accident, something like that, call our office because we can definitely help.